Hi, I am Dr.K Muthukumaran from Tutukurin, South Tamil Nadu. I am homeopathic physician, homeopathic consultant, doing homeopathy practice for more than 35 years after completing my PG in homeopathy. In this video, we are going to talk about the sinusitis, the most common problem among the people. You know, nearly 20 to 30% of people are suffering from sinusitis, the allergic rhinitis. And in that, nearly 10 to 15% of people are going for allergic breathing problem. That is bronchial asthma, wheezing. So, it's a great problem. Most of the people are suffering from allergic rhinitis, sinusitis. In this video, we are going to deal about the pathology that is going on under sinusitis, and we are going to give you a very simple and neat solution for the sinusitis through homeopathic medicine. As I am a homeopathic physician, I am going to give some guidance. That is the homeopathic treatment for the complete cure of the sinusitis. You can come away from the disease. You can be very normal without any sneezing, without any nasal irritation, without any suffering. If you are taking proper treatment and consulting a good homeopathic doctor, it is possible to come out from the disease that we are going to deal in this video. We know we are having nose in our face, isn't it? And we are having two nostrils in our nose, and the nostrils are filled with hairs. Mainly the main work of the hair, that is filtering the air that we are inhaling, and that will be filtering the dust particle that is available in the inhaling air. That is the main work of the hairs. We can, if you are inhaling few dust particles, even that is going inside the nasal cavity, apart from the hairs, that will be thrown outside with the process of sneezing. Sneezing means there is a protective mechanism that is throwing out the foreign unwanted material that is entering into the airway. That is the work of the sneezing. If it is 2, 3 or 4, that is very normal. If it is going for 20 or 30, that is very abnormal, isn't it? The allergy problem is nothing but an exaggerated normal problem, we can say. Normally we can have 3 or 4 or 5 sneezing. If you are having that is just particle in our inhaling air. But without that, if you are getting nearly 30 or 40 or more number of sneezing, that is due to the allergy problem. The mucosa, that is the inner lining of the nose, is getting irritated. That is very sensitive. So, we are getting the irritating problem and much amount of sneezing. When we are considering the nasal mucosa, when you are considering in the nose, that is lined with the nasal mucosa, that is the inner lining of the nose. That inner lining is very sensitive in sinus people, that is allergic rhinitis people. We know we are having in the nose, I told you, we are having two nostrils and that is filled with the hair, and inside, when it is going inside, we are having the nasal mucosa, that is the inner lining of the nose. If the inner lining, the nasal mucosa is very sensitive, we will be getting the allergy problem. Whatever it may be the allergy, the garden pollen or any animal tender or cat saliva or any perfumes or bad or good smell or any chill air, that will be producing allergy to us. So we will be getting the sneezing, running nose and the nasal irritation, eye irritation, tearing from the eye, burning in the eyes, great body pain, great restlessness, loss of sleep and irritation. Everything will be there in allergy problem. The people will be having their sneezing throughout the night sometimes, and some people will be getting up early in the morning. When the climate is very cool at 4 o'clock, they will be getting up and starting their own sneezing with the great nasal congestion. That will be going on for days, for months, for years. Whenever they are getting the problem, they will be taking a pill that will be controlling the problem. But pill, other medicine of the other system of medicine may not be giving complete cure to you. Whenever you are getting the allergy problem, the people will be taking the pill. But if you are taking the homeopathic treatment, proper treatment, we can come out from the disease. We can completely cure the disease. That is possible with homeopathy. We have to correct the nasal mucosa. The sensitive nasal mucosa we have to correct. Because all the other people there in our house, there are more number of people will be there in your house, isn't it? But all other people are very normal. Only particular individual is getting allergy, isn't it? All are that is inhaling the same air, they are taking the same food and living in the same room, but they are not getting the disease. Only the sensitive people, the people who are having the nasal allergy, will be getting the sneezing and nasal irritation. So we have to correct that individual only, isn't it? Why? The sensitive nature has to be corrected, that's all. It is not necessary, or it is not possible to give complete cure by detecting the allergen. So many people will be detecting the allergen that is producing allergy to you. They will be having so many tests and finding the allergen which is producing allergy to us. But it is not possible to avoid that allergen. If oxygen is producing allergy, can we stop the breathing? Or your common food particle that is producing allergy to you, you can avoid that. It's not possible, isn't it? Because all are taking the same food, all are breathing the same air that you inhale. So it is not possible and advisable to find out the allergy and avoid the allergen that is producing allergy to us. We have to correct the individual only. Then only we can give the complete cure. Then we know the common causes, isn't it? The common animal tender and garden pollen and any smoke or any perfume smell, bad smell or pleasant smell, whatever it may be, or chill air, that will be producing allergy to the people. And they will be getting the normal symptom of running nose, nasal irritation, eye irritation, there is tension and worries by thinking the disease and loss of sleep, everything will be coming along with the rhinitis. And what can we do for this? We can take proper treatment, and it is not necessary to take a pill that is giving temporary relief to you, isn't it? We have to go for proper treatment, then we can come out from the disease. And some people will be having sinusitis along with the nasal problem. We know the sinus cavities or the cavities that is there around our nose. We are having 4 pairs of air rooms in our skull. The main purpose of air rooms, that is to reduce the weight of the skull. When we are talking, vocal cord is producing sound, and that sound will be amplified by the sinus cavities. We are knowing the sinusitis, that is the sinus. When there is inflammation there in the sinus, the condition is being called a sinusitis. The same nasal mucosa, like that of mucosa, is there inside the sinus cavities also. If you are having allergic rhinitis, that is the allergy in the nasal cavity, the same allergy can be there in the nasal cavities also. Like that of the nasal secretion, there might be some secretion there in the sinus cavities. So when the secretion is more, that will be having some sort of collection there in the sinus cavities. We know it is a cavity, isn't it? It is the nasal, paranasal cavities, paranasal sinus, so it can be a room. So when it is filled with fluid, that will be giving way for the action of the bacteria or virus in producing sinusitis. So we have to correct the nasal mucosa as well as the sinus mucosa also to give complete cure. The same sort of allergic nature will be there in the nasal cavities also. So we have to correct the nasal cavity also for complete cure. Usually, when we are finding the investigation to find out the allergen, many people will be going for the normal routine blood test, isn't it? You will be going for hemoglobin and total count, differential count, ESR and everything. When you are finding the differential count on WBC, you will be finding the eosinophil count, isn't it? And people will be saying, I am having eosinophilia. What is eosinophilia? That is rise in the eosinophil count. Why it is getting raised? Eosinophil is their cell, a type of white blood cell that is responsible to reduce allergy in our body. So whenever you are having allergy in your body, the eosinophil count will be getting raised. The rise of the eosinophil count is not a disease. If you are reducing allergy in your body, the eosinophil count will be getting reduced. If you are having more allergy, the eosinophil count will be more. When there is problem, more police people will be there. When the problem is over, the police people will be going away, isn't it? Gathering of the police people is not a problem. When there is problem, they will be coming to protect everyone. Like that same way, if the allergic nature is reducing in your body, the eosinophil count will be getting reduced automatically. It is not necessary to give any medicine to reduce the eosinophil count. We have to reduce the allergy only. So don't bother about the eosinophil counts. It will be getting reduced if you are correcting your body, if you are correcting your allergic nature. And we'll be going for X-ray to find out the sinus cavities, whether it is hazy or very normal. Like that is, we are finding the diagnosis there. And if it is needed, we are going for CT scan or any other thing. And some people will be finding the antibody, that is the antigen, IgE antigen. The IgE antigen is responsible for allergy. So if it is getting raised, we will be considering you are having some sort of allergy, whatever it may be, nasal or whatever it may be. IgE antibodies will be raising in our blood. So these are the common investigation we are doing for the allergic rhinitis or sinusitis. And some people will be saying, I am having a sort of deviation in my nose, so I am getting the irritation and sinus. So I am going to correct my nose. But that is not advisable, because nasal deviation is not a causative factor for the allergic rhinitis. It may be a predisposing factor. It is not possible to give complete cure by doing the nasal cavity correction. Septum, they are correcting the septum that is dividing the nose, isn't it? Some people say my septum is deviated to right side or left side, so I am going to correct that. It is not advisable. You won't get any relief even after doing the correction. That is not at all a causative factor for the sinusitis. So please don't go for surgery. And some people will be having the nasal polyp, a growth inside the nostril due to the allergy. When the allergy is advancing, the proliferation will be there. Some sort of mass will be hanging inside the nasal cavity, being called as nasal polyp. And they will be removing the nasal polyp by surgery every year. That is also not at all necessary, not at all advisable. If you are taking proper treatment, we can completely correct the sinusitis, we can correct the nasal polyp and everything. Possibly with homeopathic treatment, proper treatment. Okay. And in the same way, some people will be having, along with the nasal problem, some eye congestion will be there. So they will be going for the eye doctor and finding the correction for the eye problem. But if you are having allergy problem, the nasal problem, definitely you will be getting the eye problem also. But if you are reducing nasal allergy, definitely your eye will be become very normal. It is not necessary to give any separate treatment for the eye diseases. If you are correcting the allergy, the eye will also become very normal with homeopathic treatment. So please consult a doctor near by you, a good homeopathic doctor, and that doctor will be guiding you to take the proper homeopathic treatment, and he will be completely correcting you. It is possible with homeopathic medicine. Homeopathic medicine, that is very simple medicine. That is it is possible to get rid of the disease, whatever it may be, allergic problem, allergic rhinitis or breathing problem, allergic bronchitis or wheezing. Some people will be going for wheezing. Along with sneezing and suffocation, they will be going for breathing difficulties also. They will be getting up in the night hours and having breathing problem. So don't take pills for allergic rhinitis or wheezing, whatever it may be. Don't take any puff. Take proper homeopathic treatment and get away from the disease. You can come out from the disease. It is possible with homeopathic treatment. So please consider, that is, find a doctor nearby you and get corrected. Okay, that is possible with homeopathic treatment. You can subscribe my channel and you can further follow my videos. Thank you very much.